Here on the Jersey Magazine this morning at 105.5 WDHA, I'm Jim Monaghan, and my guest is Dr. Andrew Boxer. March is Colon Cancer Awareness Month, and I'm going to try and see if I can get this out. Gastroenterology Associates of New Jersey. That's a lot. That's a mouthful, Dr. Boxer. Good morning and welcome.
Good morning. Thank you. Thank you for having me, and thank you for helping bring awareness to Colon Cancer Awareness Month.
Before we do that, let's bring some awareness of our listeners to you. You're a Jersey boy, born and raised, right?
Absolutely. So I was born in Mountainside Hospital up in northern Jersey, and then I lived out in Rockaway. I'm a proud Rutgers grad for undergraduate. I stayed there for college. I did my medicine and gastroenterology training out in New York City, and then immediately came back to northern New Jersey and have been there ever since.
And you're also a big WDHA listener, I know, as well.
Absolutely. So I can remember getting my cassette tapes out and recording Merry Christmas, one of my absolute favorite things that DHA used to do, and thankfully brought back this year.
Yes.
I could remember going and seeing TC kind of with all the animal rescue and kind of old shows where winning Quiet Riot tickets and going with you guys. I mean, a bunch of great memories and a bunch of great memories with the shows that you guys still do down at PNC. Absolutely. I love DHA.
You know, you mentioned Rutgers, and just to take this off track for a second, I don't know if you follow any of their sports, but the baseball team is off to a terrific start this year. And I'm a big fan of their coach, Steve Owens. He's doing a great job at Rutgers. So let's talk about March being Colon Cancer Awareness Month. For our listeners who maybe aren't as up on it, colon cancer is preventable, treatable, beatable. In what ways? What's the best way to prevent it?
Absolutely. So in fact, there's actually only one way to prevent it, and that's a colonoscopy. So
I knew you were going to cut right to the chase there.
Yeah. So just to take a step back, I mean, the first thing we need to do is kind of identify the problem. So what is colon cancer? Colon cancer is kind of just what it sounds. It's colon cancer, large intestinal cancer, rectal cancer, all the same thing. And there's a lot of it out there. This year, over 150,000 Americans will be diagnosed with colorectal cancer. It's the second most common cause of cancer death out there.
Yeah, I didn't realize that. Second only to lung cancer. That's a staggering statistic right there, Dr. Boxer.
Yeah, and it's one of the actually very few preventable cancers. The way that colon cancer occurs is you get a polyp or a small growth in the colon, and it grows and it grows and it grows, and one day it grows too big and it turns into a cancer. And that cancer keeps growing and growing. And then eventually you start getting symptoms, whether it's pain or bloating, constipation, blood in your stool, weight loss. That usually doesn't occur till it's kind of way down the road that you're kind of a stage 3, stage 4 cancer and symptoms start happening. There are kind of tests out there, whether it's stool tests or blood tests, that could suggest something's going on. But really, the only way to know kind of what's going on is a colonoscopy. It's the only preventable way. What a colonoscopy is we give you a big laxative. Like, we'll give you diarrhea, we'll clean you out so we can see inside. Then we give you sedation, anesthesia. You're comfortable. We take a small flexible camera, take a look through the colon, see what's going on. If there's something as dangerous as a cancer, and we find it early, then it's beatable, treatable. If we find something like a polyp, something that could turn into a cancer, it's routine for us to go ahead and remove it right then and there to dramatically reduce your risk of cancer. And really, this is the only thing out there. People talk about all these stool tests and blood tests and things like that. Nothing will actually prevent cancer, only a colonoscopy.
What kind of strides have been made over the past few years in this area, doctor?
Yeah, absolutely. So the first is awareness. And people probably start kind of, if you want to start talking about awareness, we go back to the Katie Couric effect. So Katie Couric's first husband was diagnosed with colorectal cancer at a very young age, and found an absolutely excellent doctor, a guy by the name of Mark Putchapin, who is the head of gastroenterology over at NYU right now. And He did Katie Couric's colonoscopy on the Today Show kind of many years ago, and people started realizing, both men and women, that this is a cancer that affects both men and women, and that there's no reason to be afraid of a colonoscopy. This is not an embarrassing thing. This is something that you could do for yourself. So the first is awareness. So people are starting to many years ago realize that this is something that's prevalent, and that they could do for themselves. In addition to that, there's been kind of on the gastroenterology side, a lot that's been occurring kind of behind the scenes in the last decade or so. So improved preps. So the prep is not that horrendous prep that patients are used to or talk about, that big gallon that you have to drink that just really is really horrible.
There are some horror stories out there from years past.
So there's way better stuff. And also our equipment is way better. In addition to that, there's been a national push to have high quality colonoscopy. So there's this program called GI Quick, where they help gastroenterologists achieve excellence, and kind of this is something that most gastroenterologists will participate in, help make sure that we're doing adequate exams. So one thing that's very important that you should ask your doctor is, what is your ADR, or adenoma detection rate? And adenoma is that type of polyp that could turn into cancer. So gastroenterologists should know what their ADR is, and you should be seeking someone who has a very good ADR, someone who has a good quality number. So kind of you want an ADR of 20% for women and 30% for men, and kind of the higher, the better. So there's been a lot of strides out there, but mostly awareness. You can't do anything unless patients are willing and know to go. The other big thing is the American Cancer Society about 6 months ago realized that colon cancer is becoming a younger disease. So young onset colon cancer is becoming a real problem. So they've pushed the starting age to 45 and above for everyone. They've brought it down from 50. Young onset colon cancer has become a real big problem. So nowadays, if we're seeing patients that are in their 20s and 30s that have symptoms, you got to go. This is not something that is reserved for people 45 and above. If you have symptoms or a family history, we got to get you in early.
What are some of the symptoms? Because I know oftentimes someone doesn't realize they have it because they don't have symptoms. What should we be looking for?
Absolutely. So the first thing I always say is the patients know their body best. So if something doesn't seem right to you, come see a professional. Things to look out for are blood in the stool. So commonly blood in the stool might just be from hemorrhoids, but you never know unless you look. Unexplained weight loss. So if you're not trying to lose weight and you're losing weight, if you have an anemia or low hemoglobin, low blood counts, that could be of concern. If you feel kind of a change in bowel habits. So used to be constipated, now you're having diarrhea. Used to have diarrhea, now you're having constipation. Feel more bloating, anything like that. If something digestively seems weird to you, go see a gastroenterologist.
How much does diet affect this?
That's a very good question. The answer is nobody really knows. So ultimately, the one thing we do know, smoking affects this. So smoking is bad for cancer. So smoking will affect patients' increased number of polyps and colon cancer. Diet, we're not sure about. So there are some great studies, particularly out of Europe, that show patients who eat a lot of processed food being fast food, potato chips, things like that, where a large part of your calories are from that really suggests that you're an increased risk for colon cancer and colon polyps. There are some studies that are not as good that show that red meat eaters are at an increased risk. Potentially patients who are vegetarian are at a decreased risk. These are things that the jury's kind of still not clear about. But certainly smoking and highly processed foods, I would stay away from.
You just described at least part of my diet. I don't smoke. I quit smoking years ago, but I am prone every once in a while to driving past that fast food restaurant. Oh, boy, a double cheeseburger tastes pretty good. Right
yeah. And once in a while is fine. Don't get me wrong. In these studies, they're looking at people where 20, 30% of their daily calories are from this. So it's not, on the weekends, what person from Jersey is not going to love a barbecue and a beer? So it's not that I'm talking about. It's when you're going kind of every day, kind of for lunch, having kind of fast food, potato chips, sodas, things like that. That's what you want to be staying away from.
Let's go back, and we're speaking with Dr. Andrew Boxer this morning here at 105.5 WDHA from the Gastroenterology Associates of New Jersey. March is Colon Cancer Awareness Month. You're a young kid, you're growing up here in New Jersey, and you decide you want to be a doctor. What age did that happen?
Oh, so interesting. So I was an engineering student at Rutgers, and somewhere between my sophomore and junior year, I just realized that I could not work in an office. I couldn't work with computers. And at the same time, I was doing some research over at Robert Wood Johnson Hospital. And I kind of the light went off in my head. Like I can do this. This would be kind of more of a lifestyle for me, talking to people, interacting. And so I was probably about 19, 20 years old. And I just kind of pivoted right away and kind of just went for it.
And when did you decide, now you've made the decision to go into medicine, when did you decide to go into this aspect of medicine?
Ooh, so that's a hard decision. So your third year in medical school, you kind of see it all. And kind of no matter kind of every month I was doing something different. And whatever I was doing, I just thought was absolutely excellent. And that was what I wanted to do kind of for the rest of my life. And then kind of the last thing I was doing was internal medicine. And I really liked the aspect where you would be with patients for kind of emergencies, life-threatening aspects. You would see patients for decades. And the thing about gastroenterology is it really combined everything for me. There was procedures that you would be doing. So certainly not kind of the big surgeries that you'd be doing kind of with surgery, but kind of semi-small surgical procedures. You'd have real emergencies, life-threatening stuff in the middle of the night where you could potentially save somebody's life. But you'd also have long-term relationships with inflammatory bowel disease, Crohn's, colitis, things of that nature, where you'd see people for 20, 30 years. And the thing that particularly attracted me was actually the colon cancer screening aspect, where you could prevent cancer and kind of cure somebody kind of before it even ever happened. So I really like the preventative nature about it. So it's kind of all these things all together. Once I kind of saw what was out there, I knew it was for me.
What's the most satisfying part of your job?
Ooh, that's a hard question. I
think you kind of answered it already in terms of being able to treat and prevent and cure somebody.
Yeah, I think so. I think being able to see a patient and kind of tell them that we did something dramatic for them. When we find that polyp, and I tell patients that I'm not sure exactly what this looks like. Is this a polyp that's kind of really big and it's actually a cancer? Or is this a polyp that is just about to turn into the cancer? And you're able to go and take this out and kind of prevent a big surgery and chemotherapy and mortality, morbidity, and really affect someone like that. I think it's really dramatic.
Our listeners, I know, have been hearing your commercials over the air for the past couple of weeks. And for DHA listeners who want more information on the Gastroenterology Associates of New Jersey, the website is GANJLLC.com. And for DHA listeners who want to reach out to you directly, Dr. Boxer, what's the best way for them to do that?
Yeah, so I think the best thing to do is we are a large GI group. We have about 45 practitioners. Check out our website. We have multiple offices throughout New Jersey. Find the office and the practitioner who is right for you. And we have multiple ways to get in touch with us, whether it's directly booking an appointment online, giving a call to the office or our call center. Everything's right on the website, GANJLLC.com, and we would be happy to help.
Dr. Boxer, thank you so much for spending your time with us this morning here on the Jersey Magazine on DHA.
Thank you.